Hi, and welcome to another video from the CTAD Clinic. My name's Dr. Mike Lloyd and I'm the Clinic Director. What I'm going to be looking at in the video today is some tips for therapists when doing trauma work. Especially this is true for complex trauma in people with dissociative conditions. So it's very, very easy for therapists to think that trauma work is about doing trauma work. And actually there's a little bit of variation to be had in this. And it's quite a difficult thing to try and get across sometimes, is that trauma work actually often means not doing very much trauma work. This doesn't mean it doesn't get done. It means that there's a way of being able to organise the time and the flow in order to get the trauma work done. Now, we work in a phase treatment model here at the clinic, so we have stabilisation, trauma exploration, and then the integration section at the end. And this can take place over quite a long period of time, which obviously relies on people having that availability and having a therapist that can spend enough time working through that process. That's not always possible, but so what we're talking about here really is the sort of the best case scenario that can be utilised. And it's very important to start with the fact that even though there are protocols for treatment and guidelines and various different methods by which different practitioners actually sort of apply their therapy, is that every person that they see is unique and different and comes with a whole load of different things going on inside of them. So this is especially true where dissociation is present, and there might be internal worlds, internal systems, as in the case with the complex dissociative disorders like OSDD and DID, where there's a whole load of intricate things going on behind the scenes, and we have to be mindful of this and take this into account when we apply our work. There's also the sort of the personality side of things, is that some folks are just extremely robust and resilient and can really sort of take on a heavy load, and others are very, very sort of fragile, and so they're highly traumatized, and they may be incredibly phobic of any kind of trauma conversation that might take place, thinking about the past, thinking about the experiences, or they may be very phobic of the internal world, and there's no communication, there's no collaboration, there's nothing on the inside to really sort of platform and scaffold the trauma work as it needs to be done. The pacing then for everybody is going to be an individual thing, is that we can't have a one-size-fits-all type process going on. This type of work just simply doesn't allow that to take place whatsoever. Everything has to be done on a patient-centered or person-centered, very unique, very individual basis. That's simply the safest way to go about this. So we can have these guidelines, but we need to actually work with them, with the individual and the system that we're working with, not as some sort of broad sweep approach. And it's one of those things that a lot of people just want to get on with it. I mean, some people may have waited years on waiting lists, or because of finances or personal situations, they may have waited years to get into therapy, and they finally get to sit down with a therapist and they just want to get on with it. I totally understand that, but that isn't really, again, a particularly safe way of going about it, just to sort of like head in there, jump straight to the trauma. And what can often happen is both therapist and patient get locked in this speed competition thing for like, let's get the trauma work done as fast as we possibly can, let's just dive straight in there and let's do it. That works fine for some particular types of therapy, like we'd say like the simple trauma type thing, but for complex trauma it really doesn't work very well at all. So just diving in and getting on with it is not a particularly useful way of going about things. But sometimes therapists just want to get on with it. They want to see the results. They want to cure you of your trauma. I want to make you better as fast as possible. And the patient or person, the system that they're seeing is like, yes, bring it on. I want to do all this as fast as I can as well. Let's just get on with it. I don't want to waste any more time. Dive in, make it happen. That's not really what we should be doing at all. Other people might want to achieve integration as fast as possible and just, I want results, I want to get better, I want all my system to be working together, or I want my system to be completely absent, whatever it might be is that goal, but I just want it done fast, can we just go straight to that? And some therapists will go with the wishes of that individual and be saying, yeah, absolutely, we'll start there and we'll move on and we'll get on with it. And what I'm saying is the pacing, the way in which we have to work and take so much into account. It's not just the trauma work. There is so many different factors and variables present in doing trauma therapy like this, we have to try and be mindful and take as much of this into account. And that means working slowly. And this is one of those cases which is a little bit like the sort of the tortoise and the hare type situation. Some therapy is about being like the hare, just run, get it done, get to the finish line as fast as possible. We know that's not really practical or safe or even effective to do so. For some people, when we do this slower approach, it can feel like everything is at tortoise pace, and it is so slow, and it can feel like there really isn't a lot going on. But what we do know from that story between the tortoise and the hare is that the tortoise wins at the end of the day. It crosses the finish line and it's in good shape when it does so. This isn't about being exhausted at the end of therapy. This is about being strong and feeling powerful and feeling alive and feeling able to take on the world at the end of therapy is what we really try and achieve. And sometimes that is working at this tortoise or snail's pace. And if we think about it in terms of, the putting together somewhere for us to live, I see our trauma therapy as being digging a foundation to build a house. It can take months, it can take years. And some trauma therapy is a little bit like putting the tent up in a rainstorm. It's get it done as fast as possible because at least you're out of the rain. But that is flimsy and it is very, very fragile and it's easily knocked over. And what we want is to get people into trauma therapy to have a good pace, to do it slowly, to do it cautiously, to do it correctly, so that when the storm comes a bit later on, because it will, because life throws these storms at us, when that storm hits, is the building that has been put together in that therapy remains firm, it remains watertight, it remains safe, it remains strong. And that means that person, once they've left therapy, realistically, we don't want them coming back in because they've got everything they need to do in order to live out there in the world and be absolutely fine. So trauma therapy is about foundation building and spending time putting this house together. It's not about putting a tent up in a rainstorm. While that can feel like the thing that you want to do first of all, it really isn't all that effective. Now, there may be times when the pace needs to go faster and needs to go slower. And there may be like intermediate periods when you can do something really quickly just to get something done. Let's say, for example, if a hospital appointment's coming up and the person really needs 2 or 3 weeks of intense intervention to try and get that done, you can push the speed up a little bit and make a lot of things happen. And at other times it can feel like it might take 2 to 3 months to achieve one goal because that's the only way of doing it. So we can be flexible in the approach that we take, and there has to be a sort of a degree of consistency about the general approach that we're working towards, which is this stable platforming week after week after week. That's what we're trying to achieve, but we have to be flexible within that as well. So I think that, that's a really important tip for therapists to take on, is that even when the therapist might feel like they just want to get on with it, that isn't necessarily the right thing to do. And for the person entering therapy, they might want to just dash to the trauma and make it all right and make me well as fast as possible. That is also not always the most practical or safe thing to do. So please take these sort of things into account. Have a bit of think about this in terms of your own setup, your own process, whether you're a therapist or whether you're a person receiving therapy. And always check in with each other. It's a collaborative relational process. I think that one of the best things that we can do is check in with each other and says, how does this pace feel? Does it feel like we're going too fast? Does it feel like we're going too slow? And that's a question that we can both ask of each other. And we should be open to be critical and be thoughtful about what the answers might be and why this thing might be going as it is going. So always check in with your therapist, always check in with your patient, your client, whatever you want to call them, and work in this collaborative way to try and make it happen as best as possible. So I hope that's been helpful. It's just it's often an overlooked thing that people often have their way of doing things and they do it across the board regardless of who they're working with. And this is about just taking that step back and really thinking it through carefully, thinking about the individual needs of the person you're working with and aligning your timing and your pacing specifically for them. So please leave comments as always in the video and like, subscribe, shared, all the usual things. It is greatly appreciated that people are doing that. And we'll keep making the videos, and in between now and the next video, please do take great care.